Well, it's a really good question, and there is a lot of controversy on this. So what we know is that estrogen, for example, can reduce the stiffness of the corneas. So the corneas in vitro can stay weaker when we add estrogen. What we don't know exactly is this effect in vivo. So in patients, we have some case reports, but there is no study to prove that the cornea really get weaker after a therapy, for example, of estrogen. Another hormone that is implied is the thyroid hormones. So during pregnancy, although we have a variance of a lot of hormones change during pregnancy, our group showed that the thyroid hormones were responsible for some changes in the topography in this period, so in pregnancy. So there are a lot of controversy, but we are not sure, and we have just in vitro experiments proving that they may impact. So it's a great potential that they impact, and the future will tell us more about this. So the case is really related with hormone changes. We had a patient, she had 39 years old, a woman, and she had stable keratoconus for more than 10 years. And we know that keratoconus at this age, close to 40s, tends to be very stable in the majority of the cases. So that's what makes the case very interesting, because she was stable, but once she started using Tibolon, and Tibolon is a estrogen receptor modulator, 4 months later she started with a huge variation of the topography. So first the keratometry readings came down, and later they came up to 4 diopters in both eyes. So faced with this variation, we performed corneal cross-linking, and again, after cross-linking, we saw a flattening of the cornea, much more evident that we usually see. So this therapy may really impact biomechanics, as we saw it before the treatment. Before cross-linking, we had a huge variation, but also after cross-linking, we had a huge variation, more than we would expect. Yeah, there are some case reports, but so far there is no conclusive data. So case reports are important, and they bring us a piece of evidence, but to prove this we would need further studies. Yeah, that's a great question. So this case that we just published was the first case linked with estrogen therapy modulator. So we would advise that the woman that take therapy replacement, their ophthalmologist follow closely, so topography and tomography, to see how the corneal changes over time change or not. So a closer follow-up would be recommended.